Thank you for joining us for today's bite-sized learning session, the HHS Birthday Speaker Series, hosted by the Program Support Center, who lead the Go Green, Get Healthy HHS Sustainability Team. The theme is Planet versus Plastics. We will take questions at the end. You can enter them in the chat box. We are thrilled today to have Dr. Emily Hills. She is a research scientist at the University of Texas at Austin, where she studies the inter and transgenerational effects of endocrine disrupting chemicals as a postdoctoral fellow in the laboratory of Dr. Andrea Gore. Her work primarily assesses the cognitive, neurological, and genetic impacts of endocrine disrupting chemicals using animal models. Emily received the National Research Service Award for this work in 2022 and is one of the Phase 1 winners of the HHS Office of Women's Health Innovator Award for outreach work developing a web app to screen for endocrine disruptors in personal care products. She is a member of the U.S. Endocrine Society, which is an organization of researchers at both the national and international level that aims in part to increase awareness and regulation of endocrine disruptors. Endocrine disrupting chemicals have been used in plastics since the chemical revolution of the 1940s, and she will be speaking to us today about the health impacts of exposure to EDCs in plastic and other commonly used products. Dr. Hills, thank you so much for joining us today. Please take it away.
Well, thank you so much for that introduction. I will go ahead and share my screen. Wow, great turnout. Okay. Hopefully everybody can see this. But please just let me know if there's any problems. But I'm going to go ahead and get started. As John said, my name is Dr. Emily Hills, and I'm going to be speaking today to this bite-sized learning session to discuss chemicals and plastic and the human health implication of our exposures to these types of chemicals. I thought I'd just give you guys a little bit of background on myself. My name is Dr. Emily Hills. I am a postdoctoral research fellow at the University of Texas at Austin. And as John says, I primarily study the cognitive effects of exposure to EDCs. And I look at how these effects emerge over generations, trying to understand the endocrine mechanisms of how this occurs. So I'm a member of Andrea Gore's lab at UT Austin. She is one of the big names in the field. She's an organizer of the U.S. Endocrine Society, and these are a list of a couple of our most recent publications on this topic. So let's jump right in. Why is exposure to plastic a health concern? I'm sure many of you have heard that plastic might be bad for the environment, might be bad for you, but I think a lot of people don't necessarily understand why. I do a lot of talking with students and people of various age ranges, and I found that I get maybe half of the people I talk to have heard, that plastic is bad for them, but a lot of people don't really understand why. So I thought I'd give some background on plastics. Plastics are made from a range of organic polymers, such as polyethylene, PVC, and nylon. Those are just a few of the polymers used to create plastic. And generally, the polymers that are used to make plastics are derived from petrochemicals or chemicals used in petroleum engineering. Petrochemicals, the engineering process to create petrochemical exposes people to high level of toxic chemicals. And when I say toxic chemicals, what I mean is it has a direct adverse effect on human cells. Cancer rates are actually 50% higher in regions that have a high number of petroleum engineering facilities. But that's not really necessarily what I'm going to be talking about today. Petrochemical engineering is sort of its own directly toxic process. But another process that's involved in the creation of plastic is this process where we add certain chemicals to make the plastic more pliable. This is called the addition of plasticizers, which increase the flexibility of plastics. There's also the addition of things like stabilizers that help our plastics not degrade, which is not great for the environment, but is great when you're storing something in your fridge. And then also the addition of things like pigments for coloring the plastic, or heat resistant additives. And so the main concern when using plastic is that there is a vastly growing body of evidence that links exposure to the chemical additives in plastic with specific health impacts to the body's endocrine system. So to give a little background on the endocrine system, our endocrine tissues are uniquely sensitive. The endocrine system is a network of organs in the body. It includes things like the thyroid and parathyroid. These are involved in your growth and metabolism, the kidneys and adrenal glands. The adrenal gland regulates our stress response. Kidneys help us filter out toxins. And then, of course, the gonads, the testes in males, and the female uterus and ovaries, which are important for our reproductive processes. And then a lot of people don't really consider the brain to be an endocrine tissue, but it really is. It contains the hypothalamus, so it really controls all of these processes in our body. And so the endocrine system is uniquely sensitive specifically because it's responsive to very small hormonal changes. So it doesn't take a lot of hormone to change the way that the endocrine system works. And this system really controls our entire biological response to the world around us. And so what are endocrine disruptors? I think HHS has been doing a lot of work to increase awareness of this, so I'm sure this is probably not the first time many of you in the audience have heard this term, but endocrine disruptors are chemicals that unintentionally disturb the body's hormone systems. And they cause things like cancer, specifically endocrine-mediated cancers, which means cancers of endocrine tissues like the thyroid or the ovary, testicles, things like that. They're also associated with metabolic disorders like diabetes, reproductive disorders that can range from anything from late onset puberty, or actually probably more early onset puberty is a concern that we're seeing, to infertility. And then, of course, if children who are developing in the womb are exposed to endocrine disruptors, we're seeing an emergence of neurological impairments such as increased rates of ADHD, autism spectrum disorder, things like that. And so endocrine disruptors are concerning because very low doses can cause harm. In standard toxicological safety testing of chemicals that is done by the US EPA and chemical manufacturing companies, they're typically looking for a safe level of exposure. And when you're looking for a safe level of exposure, what you're looking for is a level that does not cause a direct toxicological effect or harm cells. But the level or the doses of endocrine disruptors that are deemed not to cause a direct toxicological effect can still interact with the endocrine system and change the way that it's working. And that is leading to these potential delayed effects. So particularly in pregnant women and in children whose endocrine systems are kind of changing and their bodies are growing and reorganizing in new ways, being exposed to these type of chemicals can cause adverse health effects to occur many years after the exposure. And that makes it very difficult to create this direct cause and effect line. The effects of endocrine disruptors can at times be irreversible because the way that they work in part is to reprogram the genetic code of the exposed individual so that their body will always kind of work differently because they're being exposed during this very important period of development. And then finally, I think the final major concern with endocrine disruptors is that their effects are largely overlooked. And that kind of goes back to this idea of standard toxicology testing, not really looking at the effects on the endocrine system because they're not a direct toxic effect. They're more of a latent and emergent effect that occurs over time. I know that was a lot for me to say all at once, but we'll break all of these concepts down a little bit more as we go. So I thought first I would talk a little bit about some of the major health effects of endocrine disruptors that we are seeing emerging over time. To me, one of the most concerning is that the rate at which male fertility is declining. There is a book by Dr. Shauna Swan called Countdown. It's a great book that breaks down some of the main chemical plasticizers and their effects on the male reproductive system. But the major takeaway from her research is a very consistent finding that sperm counts have been dropping since the 1970s. In fact, worldwide, including non-developed countries, sperm counts have reduced by 40% since the 1970s. And it's very strongly suspected that this is due to our exposure to phthalates, which are one of the chemical additives in plastics. Another concerning trend is that breast cancer diagnoses in women under 40 is increasing by 3% every year. This recently overtook lung cancer as the #1 cause of cancer-related death in women. And then finally, we are seeing that worldwide obesity has more than doubled since 1980. And this level of increase, or this is occurring even when you control for lifestyle factors like eating more processed or fatty foods. And it's suspected that this is due to exposure to endocrine disruptors that are known as obesogens and diabetogens. And so each of these kind of is an endocrine-mediated health effect. Fertility is a reproductive health effect. Breast cancer is an endocrine-mediated cancer, and obesity is a metabolic process. So these are all kind of like the, I would say, like the big 3 effects of exposure to endocrine disruptors. And so plasticizers and plastics are not our only endocrine disrupting chemical exposure source. There's also things like flame retardants, industrial chemicals, phytoestrogens, and pesticides. And all of these are kind of, potentially interacting with our thyroid, causing metabolic disorders and impairing function of the reproductive system. And anytime I want to talk about EDCs, I also want to mention that the health impacts of EDCs do disproportionately impact underrepresented groups. Many of these effects are much higher in the Black community. So we know that public awareness of the harmful effects of industrial chemical we do know that public awareness of the harmful effects of exposure to industrial chemicals is high. But what the research is showing is that people are not really aware of their personal routes of exposure. So you might think that living in a chemical manufacturing community is going to adversely impact your health, but you might not be thinking about how drinking from a disposable plastic water bottle could be having similar effects, and you're getting these constant exposures over time. So let's talk about what endocrine disruptors are present in plastic. According to a recent survey by the US Endocrine Society, there are 144 chemicals or chemical classes that are known to be hazardous to human health found in plastic. They serve a variety of function, working as antimicrobials. As I've mentioned, we've also got the plasticizers, flame retardants, solvents, and stabilizers. These chemicals act as hormone mimics. That is sort of the primary method via which endocrine disruptors interact with the human body. So when you have normal endocrine signaling, you have a hormone, let's say testosterone, and these hormones bind with hormone receptors in cells, and they cause some kind of cellular response. Now, endocrine disrupting chemicals share structural similarity with the body's endogenous hormones. And so sometimes they act as hormone mimics, and they can overwhelm a cell and cause an increased cell response when it's not supposed to be happening, or they can act as hormone blockers, and they can bind to the cell and make it impossible or more difficult for the body's natural hormones to bind to that cell, thereby stopping normal hormonal processes. And this affects development of the body and brain in children, and just normal reproductive function in adults, and other endocrine-mediated processes. Some of the EDCs that are commonly used in plastic include things like bisphenols. Bisphenols are used to make polycarbonate plastics and epoxy resins. They leach into food and beverages over time from the plastic that they are contained in. I think most of you have heard of BPA. This is sort of the penultimate bisphenol that everybody has heard of. And there's a lot of research on BPA. And as I go through some of these, I'm going to be listing pretty similar health effects, and that's because these are all endocrine-mediated processes. But BPA has been shown to reduce fertility, alter reproductive development and function, impair brain development, alter function of the metabolic system, such as via the thyroid. And it's also an exposure to BPA in utero is associated with increased cognitive disorder diagnoses in children. In fact, there's over 7,000 research papers that support the harmful effects of BPAs. And many countries, including the US, have restricted or banned its use. This is partially due to public outcry about BPA. A concept that I want to come back to is that even though BPA is restricted or banned for use, there are many replacement bisphenols that have been constructed and taken its place, and they often have similar health impacts. This includes things like BPS, BPF, BPAF. So the class bisphenol is the concern, not just BPA, the individual chemical. The next class that I'd like to talk about are phthalates. You may remember I mentioned that phthalates are concerned with, or are implicated in the impairment of the male reproductive system. Phthalates are used in plastic to promote flexibility. They're considered plasticizers, and they help stabilize PVC. They're used in things like medical devices, like IV bags. They're found in food packaging. They're used in plastic children's toys. And then a non-plastic use for phthalates is that they're contained as emulsifiers in personal care products. Our primary exposure to phthalates occurs via oral ingestion, inhalation, and skin contact. So essentially eating foods that have been contained in phthalate containing materials, and using products that contain phthalate in them on our bodies. So some of the major health concerns of exposure to phthalates include things like reduced testosterone and estrogen levels. These are the gonadal steroid hormones. Phthalates can block thyroid hormone action, which can impair growth in children and development of the brain, and then also alter metabolic function in adults. And they're also reproductive toxicants, which means they are toxic in the reproductive system. I think the most concerning health effect of phthalates is that they can cause malformation of the male reproductive system. This is a condition known as phthalate syndrome in rats, and there is a synonymous syndrome in humans, which essentially causes the penis to be smaller over time and the associated hormone levels to be lower in males that were exposed to phthalates in utero. Some phthalates, including DEHP and DBP, are banned for use in children's toys in the US. There are several more phthalates that are banned in the European Union, but overall, most of the use of phthalates are more restricted by individual states and not so much at the federal level. Continuing on, the next, I think, class of chemicals to be concerned about are perfluorinated chemicals. This would be PFAS, or forever chemicals, which have received a lot of media and public scrutiny in the last few years because of a couple of high-profile PFAS spills that have occurred, and then the high rates of cancers and metabolic disorders that are being seen in the communities that have been exposed. Perfluorinated chemicals are used to make fluoropolymers for plastics. These are essentially non-stick surfaces with high temperature resistance. So things like pipes and valves and pumps, they're more used for industrial purposes or community building type purposes. So the primary exposure that humans have is through their drinking water, at least from perfluorinated chemicals that are contained in plastic, but we're also exposed through things like cookware and fast food wrapper. And this is because PFAS are sort of water resistant chemicals. And so they're used for anti-stick, anti-slick type of materials. PFAS have been shown to affect the immune system, liver and thyroid function, and they also alter puberty, raise breast cancer risk, and are associated with other endocrine-mediated cancers such as testicular cancer or thyroid cancer. Our next class are the brominated flame retardants. These are BFRs. They are used to reduce flammability in plastic products. BFRs are contained in electric casings and wire coatings. They can be found in plastic children toys, and they're also used to stabilize plastics that are going through the recycling process. So they're added in at that time. Our primary exposure to BFRs occurs via inhalation. So we have a lot of products in our homes that can contain BFRs, and those products will create dust over time that we are inhaling. And then also through oral contact. So one of those examples would be children chewing on plastic toys that contain BFRs. And then the health impacts of those are very similar to what we've gone through already. Impaired reproductive development, altered thyroid function and neurodevelopment. And then I think a recent study showed that BFR exposure was associated with psychomotor and attentional related IQ performance in children who had been exposed or who had detectable levels in their blood. And the final class I'm going to talk about are dioxins. These are considered the world's most toxic substances. So this is kind of a little less endocrine mediated and a little more directly toxic. Dioxins are released when plastic burns or when it's heated for recycling. Our exposure to dioxins occurs during the manufacturing process of plastics, during recycling, and communities that have e-waste landfills tend to have high dioxin exposure. And the cancer-causing attributes of dioxins are really their primary concern, but they do also have endocrine-mediated health effects, which means impaired reproductive, metabolic, and developmental function. So I'd like to return to this idea of regrettable substitution that I mentioned when we were going through bisphenols, and just tell you guys a fun story, right? Well, not a fun story, but a story nonetheless, and that is the story of bisphenols. So once upon a time, there was BPA, and it was used in canned foods and in baby bottles and in plastic bottles. But then emerging evidence began to link exposure to BPA with increased rates of breast cancer, reduced fertility, earlier puberty in girls, and increased diagnoses of neurological disorders in children. And this led to large public outcry. People began to demand products that did not contain BPA. And so that's what we got. We got products that were BPA free, and that represented great progress. Except the problem with this is that we have now got products that contain BPS, BPF, BPAF, BPZ, and these are all the same products that are being marketed to us as BPA free, and that's not a lie. It is BPA free, but it's not BP free. And so this is the concept of regrettable substitution, which is replacing a harmful chemical with a structurally similar substitute for the same purpose that ends up having similar or potentially even worse toxicological effects. So BPA is our canonical example. The substitute bisphenols that are used in products that are labeled BPA free are associated with similarly harmful health effects, but they receive less public attention. And bisphenol is not the only class that this occurs to. There are regrettable substitutions of phthalates. PFAS, which have received so much attention recently, have been phased out for something called Gen X. And there's a lot of research that Gen X has the same health effects as its ancestral chemical PFAS. And then things like polychlorinated biphenyls were replaced with things called polybrominated diphenyl ethers. And then these were replaced with organochloride ethyl I forget, but it's a long process of replacing chemicals with slightly different substitutes that ultimately have the same health effects because they are essentially the same chemical. And the problem with this positive feedback loop is that scientific scrutiny just can't keep up. So it takes years and years of research to identify and create enough evidence that a chemical is harmful that people will begin to notice it and demand change. And in that time, it's substituted for something else, and then the process begins over again. And so it's not a sustainable method for addressing the harmful effects of endocrine disrupting chemicals. We have to start looking at things as classes and not as individual chemicals. Next, I'd like to talk about microplastics and nanoplastics, which are just smaller microplastics. I discuss plastic exposure with a lot of people, and sometimes I'll say things like, oh, have you ever heard that exposure to plastic is bad for your health? And sometimes people will say, no, I've never heard that. And so I ask, okay, have you heard of microplastics and that they're bad for you? And I almost always get a yes to that. And so I thought it would be a good idea to talk about what microplastics are and why they're harmful. So microplastics and nanoplastics are just small plastic particles that come from the degradation of plastic. They are persistent and they are ubiquitous. And what I mean when I say they're persistent is that they do not break down in the environment or in our bodies. And when I say that they're ubiquitous, I mean they are detected everywhere. They are detected in the polar ice caps. They are detected in the seal fat. They are detected in the human body. I think something like 90% of people, probably more than that, have microplastics in their body, and they're present in the endocrine tissues of the body, as well as being passed on through the placenta and being found in things like the fetal brain. And the reason that microplastics are a health concern is because the same chemical additives that are used in plastics manufacturing are present in microplastics. So while a lot of our exposure to the chemical additives in plastic come from the breakdown and transfer of plastics leaching into foodstuffs or into the air that we're breathing, microplastics actually represent a direct and continuous route of exposure to the chemicals that are in plastic, leaching into our tissues directly from the source. So from this point, I'd like to talk a little bit about what we've been doing as a society to try and address the plastic issue. And I'll start with plastics recycling and kind of talk about how this may actually be compounding the issue of our exposure to endocrine disruptors and other toxic chemicals in plastics. So when plastics are recycled, the process often involves the melting and reforming of plastic materials into a new plastic source. So the mechanical and heat stress that's applied during recycling creates a less stable plastic, and that makes it easier for EDCs or endocrine disruptors that are contained within the plastics as additives to more easily leach out into the contained products. There's also a concern that plastic degradation not only frees the bound EDCs, but also as plastics are recycled, they can actually cross-contaminate different chemicals that are contained in different plastic types and create new harmful compounds or unique chemical mixtures that can have endocrine disrupting effects. So I'm not anti-plastics recycling, but I am anti-using recycled plastic for for food containing processes or anything that might be getting into the human body. Another trending topic would be bioplastics. This has been touted as a potential solution for the plastics crisis. Bioplastic is a biodegradable material. It more easily breaks down than traditional plastic, and it comes from renewable resources, so it can be used to reduce the problem of plastic waste. I think that's all great, but the problem with bioplastic is that they still contain the same chemical additives as traditional plastics, those plasticizers the heat resistant materials, the solvents. And so I think it's something like every bioplastic that has been tested still contains chemical additives that have endocrine disrupting properties. So while they may represent a solution to plastic pollution, they don't represent a solution for the harmful health effects of plastics. And so you might be asking yourself, well, okay, recycling isn't maybe our best option. Bioplastics maybe aren't our best option. What do we do? Replacing plastics is our best option, and it's replacing them with things like glass or wood or metal. The best way to reduce your exposure to harmful chemicals and plastics is to not use plastic where you can in your life. I like to give a couple of suggestions for lifestyle changes that people may be able to easily integrate into their life. This would be things like investing in glass Tupperware or using ceramic, glass, wood, or metal products in the kitchen where you can. Recently, a report came out that showed that plastic cutting boards release, hundreds of thousands of microplastics into food that is cut on them. So a wooden cutting board would be a good example of a way to reduce your plastics and microplastics exposure. And then, consider replacing your plastic water bottle with a metal or glass one. And then also, not all plastics contain EDCs. So you can look at the icons on the bottom of plastic bottles and try to pick ones that are contained in the 1, 2, 4, and 5 categories. These are considered safer plastics, while the ones to avoid would be the 3, 6, and 7 categories. PVC or vinyl contain phthalates. 6 contains the polystyrene foam. And then 7, or that other category, can contain bisphenol A or other bisphenols. So those would be the plastics that you would want to try to avoid in your life when you do use plastic. And then I think it's not really feasible for people to just cut plastic out of their lives. There's a reason it's so popular and so used, but we can, have a more informed use of plastic as well. There are ways that you can use plastic that reduce the leaching of chemicals out of it and can help you protect yourself and the people you love. And that would be doing things like throwing out plastics that have obvious signs of etching or cloudy appearance. So that scratched up Tupperware that you've had for 20 years, it might be time to go, that you could replace it with, a more stable plastic alternative. One of the primary suggestions that I make is not to heat plastic. The process of heating plastic exacerbates the rate at which chemical contains in plastic leach out of it. So this is particularly something to be thinking about when you're heating up food that might be contained in a plastic Tupperware. You might just put that food in a bowl before you heat it up, and then you're directly reducing your exposure to the chemicals that are leaching out of the plastic when you do that. You can also increase the lifespan of your plastics by washing them by hand instead of in the dishwasher, and throw out products that are exposed to excessive heat. So I'm here in Texas. We all have that water bottle that's been in the car for a summer, and then you have that desperate moment. Don't do it. Or that could apply to things like sunblock and non-consumption items as well. And then also you can be mindful of what you contain in plastic. Things like acidic foods and drinks also, similar to heat, increase the rate of chemical leaching. So try to contain more stable products in your plastics. And then finally is to keep your single-use plastics single-use. I think many people, including myself, are very motivated to try and get the most out of the products that we use and try to contribute as little to waste as possible. But when you're using disposable water bottles or Ziploc bags, that increases the breakdown of the plastic, and it also increases microbial production in the plastic. So it's not maybe the best way to reuse those plastics. If you want to try to reuse them, maybe use them for things that are not food or body contact. And then as I'm finishing up, I just want to talk about endocrine disruptors that are used in processes outside of plastics production. The same chemicals of concern that are used in plastic are used in things like personal care products. Phthalates are used as emulsifiers to carry scent. Parabens are used as antimicrobials. You can use things like fragrance-free, paraben-free products and look for labels like phthalate-free. When I say personal care products, I mean things like lotions, soap, shampoos, stuff like that. Cookware is also a source of exposure. Like I mentioned, the PFAS are used as anti-stick in cookware and Teflon, and they're also found in waterproof clothing. So you might consider trading out your anti-stick cookware with something like steel or ceramic. For me, I'm like, okay, I'll wait until the pan is no good. And then when I finally do buy new pans, I'm just planning not to buy anti-stick ones. Pesticides and fungicides represent a very large class of endocrine disruptors, and our exposure to these types of chemicals occurs when certain produce are sprayed with the pesticides or fungicides. We can reduce our exposure by washing our fruits and vegetables and buying certain organics. There's the Environmental Working Group. They actually provide an annual guide on which products you should consider buying organic. Those would be the Dirty Dozen. These basically are produce that have really high pesticides on use on them, and typically they're leafy greens, things like that. And then finally, it's the household items. The BFRs and PBDEs are used as flame retardants. So essentially, looking to buy household items that are made from natural materials can be helpful in reducing the EDC quantity in your dust around the house. So the last thing I'd like to talk about is how our exposure to endocrine disruptors is actually unequal. Research consistently finds that racial and ethnic disparity in exposure to endocrine disrupting chemicals. For example, products that are advertised to Black women are 5 times more likely to contain endocrine disruptors than chemicals that are advertised to white women. This could be because things like hair relaxers and oils are more likely to contain these products, and also a higher consumption of things like vaginal douches, which can contain endocrine disrupting chemicals. Some other reasons for this are that facilities that produce EDC waste are more likely to be constructed in lower income communities. And then also that the consumption of foods that are exposed to EDCs, like fast food packaging, non-organic produce, and higher consumption of canned goods can be higher in these communities. Oh, look, here's a video. And the actual last thing is, so in an effort to address this issue, I put in an application to HHS's EDC Innovator Award and ended up being funded to develop EndoScreen, which is a web app that's designed to detect EDCs in personal care products. Just plugging this, I suppose, as something you can use in your home to easily kind of scan through your own products. It works very simply. All you do is take a picture of the ingredients and you get a report back about EDCs, their known health effects, and links to research articles so you could see the evidence for yourself. We also provide a couple of metrics, things like the number of articles so that you can sort of address how reliable the evidence is about any one chemical being detected. We also have kind of broad categorizations of the health effects, and then, as I mentioned, links to specific articles. And the app generally just kind of provides comprehensive information about endocrine disrupting chemicals, from the endocrine system to the specific chemicals and research articles. Hopefully it could be a good resource for anybody who's looking to learn more and protect themselves. So that's something that I've been working on, just to kind of try and increase awareness of what is a very concerning impact on human health. So I would just like to thank everybody for listening to me. Thank you, HHS, for inviting me to give this Planet versus Plastic talk. I hope that it was informative. You can find my contact information here. These are some collaborators that I worked with on Endoscreen, Robert Pearce and Sean Grissom. And then also, just thanking the Endocrine Society, the OASH, and all the people that I've worked with, and of course, Andrea Gore, who brought me into the field. So I'm happy to take any questions, answer them to the best of my ability, chat.
Emily,
Thanks.
this is Diana. Thank you so much. Wow, where do we begin? First of all, outstanding number of interested people in this topic. I know we have quite a few hands up. Here we go. I apologize if I'm not doing these in order, but I'm going to go ahead and unmute people right now. Start with Eileen Tomczyk. Eileen, would you like to ask your question? Let me see if I can get you.
Thank you so much.
There
Oh
we
my
go.
gosh. Emily, you have shocked me as well as I'm sure a lot of many other people. We hear about the BPA and everything but when you see it in black and white, it's astonishing. And the only thing I can think of is after this call, I'm going into my kitchen getting rid of all my plastics. But are we able to share this presentation with our family and friends, or do we have to just keep it here? Because this is information that I just don't want to sit on. You know what I mean?
Absolutely. I think I shared with Diana a copy of the slides. So anybody who wants to request them, you can reach out to me, you could reach out to her. I'm happy to share that. I definitely want as many people to know as possible. So please share.
Oh, thank you. Thank you so much. That was it for me.
Great. How about Teresa Tran?
Yes, can you hear me?
Yes,
First of
we
all,
can.
thank you, Emily. This is great information. But I'm thinking not a lot of people had an opportunity to hear you and or knowing this information. Is there any effort that from your study is work with the manufacturer and or have more regulation in producing the product that related to plastic to be prevent all of this chemical?
Yes, so that's sort of a federal regulatory requirement. And certainly, maybe not me personally, but people in the field, researchers in the field, are definitely working to increase awareness. I think a lot of it comes from public pressure and just creating enough scientific evidence to inspire manufacturing change. I will not be too negative about manufacturing. And I will say that I think with appropriate public and regulatory pressure, these issues can be addressed, but there are some societal trends that have to occur first before we'll see large-scale industrial change.
Thank you, though. Thanks.
All right. How about Jennifer Haley?
Hi, so I was wondering about the silicone lids on glass containers and then things like dental angle brushes where the bristles are probably plastic and you're using them instead of floss, and then floss and things that, people don't think of as harmful plastics.
Mm-hmm.
Can you speak about those products?
I can. I know that coated floss contains EDCs, so you kind of want to use just the string floss is a good alternative. I use Tupperware that have, plastic or silicone lids. I don't expose the lids to heat. I did actually, about a year ago now, I did go through and do the big chop in my kitchen and replace all of my plastic Tupperwares with glass. And it's been nice, actually. I really enjoy having them. So if that's an option, I think that's great. But I don't think many people tend to expose their lids to heat, which
Right.
is helpful. I don't really know about toothbrush bristles. So I can't speak to that one.
Well, thank you, because your entire talk is very informative, especially about the reproductive systems. I have 5 granddaughters, and this is almost scary. That it's in their food, it's in their water bottles, it's everywhere. And we had moved to glass water bottles, but you know, the straws and things are plastic.
Mm-hmm. Yeah.
So.
Yeah, it's definitely interesting. You know, I was talking to a friend of mine who has a young child, and she was asking what she was supposed to do because he throws things, and she's like, I can't use glass because it will break. And so that's sort of when we start talking about metal and wood as potential alternatives if you're trying to reduce that plastic use with your children.
Thank you so much.
How about Pamela Costner next? Are you still there, Pamela?
Hi. So I've read that boiling water is helpful in consolidating the microplastics, and it's recommended in some, I'm thinking Guatemala is where I've been hearing that folks are doing it on a regular basis, but how about in the States? Is that necessary, recommended? And then the big water bottle companies, I've tried to pin them down and saying, well, do you do anything for the microplastics? And half the time they don't know what I'm talking about or play dumb. And I'm wondering if you see that as an alternative to some of the microplastic exposure in water.
Yes. So I think I've read somewhere about heating water. Right now, I think the suggested most effective method, and this is probably more for PFAS. I don't know if it's effective for microplastics, but I think if you're getting a chemical, you're probably getting plastic out too. Our reverse osmosis water filters are supposed to be the most effective type of filtering method that you can use. In terms of water bottles, I know for disposable water bottles, they're a pretty significant source of microplastic exposure. I'm not sure how much is coming out of like reusable water bottles, but again, I think, you know, you could drop that number quite a bit by switching to a glass or metal bottle.
Okay. And then I wanted to follow up with a couple of things. Heather Sosnowski posted in the chat, and I have found that her comment helpful about replacing, how she's gone about replacing. So thank you, Heather. And then finally, I think that the selling point for this whole getting it out into the news is smaller penises for the next generation.
Yeah.
It just seems to be a way that we can get their attention.
Absolutely. There's a reason I always talk about the malformations of the male reproductive system, because I mean, I think it's very concerning too. Like we're seeing massively dropping fertility rates in men. Actually across the board, endocrine disruptors, they are harmful in females, but the male genome is much more sensitive than the female genome for complex scientific reasons. So, well, they're not that complex, but either way, we're seeing stronger effects in males kind of across the board.
All right. Well, maybe we'll let Dan Mellon ask his question.
On presentation. This is going to be a tough question. You know, certainly we understand that a lot of these plastics are very difficult to avoid. A lot of these plasticizers are kind of necessary for some materials to have the performance characteristics that they need. I'm thinking particularly from an FDA perspective in terms of container closures and things of that nature. The science is very challenging to identify, you know, and characterize the no effect level for some of these. Given what you've looked at, do you think that there are enough data out there, or that people are looking to be able to establish permissible levels or acceptable levels? Certainly, the multiple sources for exposure from a global society perspective are very challenging, but do you think there's enough data to be able to say that there may be doses that are not problematic?
Certainly. And I will also explain why that is sort of a misleading line of thought. And the reason for that is that we are not exposed to any one chemical as a single source. We're exposed to complex mixtures of chemicals all the time from so many different sources. My lab has been studying the NOEL for a long time now, and what we're finding is when you expose a single chemical, you'll see, much less effects. But when you start putting these complex mixtures together, you start seeing broad effects across the, endocrinological board at levels where each individual chemical is below the NOEL. But when you put them together, they begin working in concert to create stronger physiological effects. And that is sort of the regulatory difficulty is, okay, sure, if I'm exposed to BPS at this level, I don't see any biological impact. But when I'm exposed to BPS, DEHP, PFAS, BFRs all together, they begin working together to create a more complex biological response.
Makes sense.
Does that answer your question?
No, yeah, absolutely. And I think it's even more complex given the fact that a lot of the effects that are being determined are multi-generational and potentially epigenetic, and we're still not truly understanding those physiological processes in the first place. Thank you very much. Really do appreciate your insights.
Absolutely. Thank you. That was a good question.
Let's see. Let's have Anuba Tripathi next.
Hi, thank you so much for your presentation. Amazing. I knew some of this stuff, but not all of it in such detail. This may have been covered, but just for everyone on the call's purposes, some of the things that came to my mind are the items that we all use every day, such as the water jugs that we filter our drinking water through, like Pure and Brita and Zero Water, etc. And that was one thing that I was wondering if how can we maximally reduce based on the things that we literally use every day? Would that type of product be best bought in a glass format? Could those pitchers be releasing microplastics, etc., leaching over time? Because people use those things over years until they break.
I'm not exactly sure what type of plastic they're constructed from. And so I would be just speaking in conjecture, but if it's available in glass, why not?
Yeah. Okay. Right. And then the other thing is, like, I don't know, it's become more common for people to place filters in their shower head, and that's contained in plastic. And then, of course, you're showering and bathing with that every day, and the water is coming through hot. And then that's another thing I thought about that I was wondering what your thoughts were about on.
Yeah, I hadn't really thought about that as a potential source. I think, there's some evidence out there for dermal uptake of some of these chemicals, but a lot of it is really like via an oral route. So even when I think an issue, but what I think about in the shower is shampoo and soap. Those are the things that I think about the most. And people will say, well, does it go through your skin? And I'm saying it's on your hands and your hands. I mean, I think we all learned during the pandemic how much we're all touching our mouths all the time. That's really what I think about more in the shower. Yeah.
Okay. I also was wondering if there's any way we have the recording available to us, because a lot of the things that were on the slides you verbalized in different ways. So I'm just wondering if the organizer would be able to make that available.
I can speak to that, and then John, I'm going to turn it over to you because we need to wrap up, but we will be sure that this has been recorded. Our intention is to post it on the Go Green Get Healthy website, which John added into the chat. there's we will make sure that the slides we can send them to everyone who joined today, because I think everyone would like a copy of these slides. And I also want to reference there was a lot of questions in the chat as well, and we will try to capture and work on grouping them together and seeing if we can get some more follow-up information for all of you. And my mind is already thinking, John, we need maybe a bite-sized session for Plastic-Free July. We did it last year on making swaps with plastic, but it sounds like it would be great to have a similar situation again, and maybe we can invite Emily and a few other experts in this arena to address our questions on all the different swaps and things out there that we could do. So with that, I'm going to turn it over to John to close out this session.
Yeah, thank you. Thank you so much, Dr. Hills, for the awesome presentation. And thank you, everyone, for the great attendance at this session. And it was very exciting for the Earth Day Speaker, HHS Earth Day Speaker Series. And I'm going to put in the chat again information about the Earth Day Speaker Series, the webpage, the Go Green, Get Healthy HHS is there. And part 2 of the series is tomorrow at 12 noon. Aidan Sharon, Director of End Plastic Initiatives, earthday.org, topic Planet versus Plastics. We're excited about this series. The recordings for each session will be posted on the webpage, and any questions can be emailed to gogreen@HHS.gov. Thank you so much, Dr. Hills. I know you have to go to another session meeting after this. So thank you for the great engagement, all the questions and comments. It was a really such an important topic. And thank you, Dinah Hirschfeld, for all her efforts on the Go Green, Get Healthy HHS and the sustainability team. Thank you so much for attendance. Have a great day. And thank you so much, Dr. Hills. We appreciate it.
Thank you.
Have a great day, everybody.